Welcome back, everyone, to another deep dive. This time, we're going to be delving into the world of health and social care.
Ooh,
Specifically, we'll be looking at the core modules of a Level 3 diploma.
okay.
It's like getting a backstage pass to see what this field is all about. So
Interesting.
you're thinking about a career change, or you're just curious about what goes into caring for others.
Right.
This deep dive is for you.
The thing is with this diploma, it
Yeah.
covers so much ground.
Huh.
From the very practical hands-on stuff to the really emotional and personal aspects of care.
Yeah, it's not just about medical procedures, right?
No, not at all.
It's about understanding the whole person and what they need.
Absolutely.
Looking at the list of modules, there are 30 in total.
Wow.
It's a lot to cover, but a few titles really caught my eye.
Okay, which ones?
For example, mobility and immobility issues of patients.
Oh, yeah, that one's crucial.
What struck me is how that goes beyond just physically helping someone.
You're right. It's not just about getting someone from point A to point B. Imagine working with someone with limited mobility.
Yeah.
You need to preserve their dignity,
Oh, absolutely.
keep them safe, and understand how their condition affects them emotionally.
Yeah.
This module likely covers techniques to help people be more independent and how to prevent falls, but it also looks at the communication skills needed to support someone who might be frustrated or feeling vulnerable.
It's really about seeing the person behind the diagnosis, isn't it?
It really is.
Another one that stood out to me was caregiving for dementia.
Mm-hmm.
I actually have a personal connection with that one.
Really?
My grandmother lived with dementia for several years, and
Oh, I see.
it's such a complex condition. I always wondered how caregivers handle those challenges.
It is a specialized area.
Yeah,
It needs a unique blend of knowledge, patience, and compassion.
I bet.
This module probably covers the stages of dementia and the different ways to communicate with individuals
Right.
who might be experiencing cognitive decline and strategies to create a safe and supportive environment for them.
Because it's really about
It is.
understanding their reality and adapting to their changing needs,
Mm-hmm.
even when it's hard for them to tell you what they need.
Exactly.
It's so important to remember that everyone experiences dementia differently.
Yes.
There's no one-size-fits-all approach.
Definitely not.
And this next module seems to really highlight that individual focus.
Which one is that?
Principles, theories, and values of person-centered care.
Ah, yes. That's a foundational one, I'd say.
What exactly does that entail?
Well, it probably lays the groundwork for understanding that care should always be tailored to the individual's needs,
Okay.
their preferences, and their values.
So it's moving away from
It is.
like a standardized task-oriented approach.
More like a checklist.
Right. And instead it's
It's about embracing a more holistic and empathetic way of providing care.
that's a powerful shift in how we think about care.
For sure.
I'm starting to see how all these modules come together
Right.
to create a well-rounded understanding of what it means to really care for someone.
It's not just checking boxes.
It's not just checking boxes.
It's about connecting with people and helping them live their best lives no matter what their circumstances are.
Speaking of empowering people, another module caught my eye.
Oh, tell me.
It's called How Care Environments Can Promote and Undermine People's Dignity and Rights.
That's a fascinating one because it looks at the subtle ways the physical environment
Yeah.
impacts someone's well-being, dignity, and autonomy.
Like, how would that even work?
Well, think about the difference between a cold institutional setting
Okay, yeah,
and a warm, inviting space that feels like home.
you're right.
Little things like access to natural light, the ability to personalize their space, having places to socialize.
Oh, yeah.
Those can make a huge difference in how someone feels about themselves and their surroundings.
It really makes you think about how much thought goes into creating a supportive care environment.
You bet. Yeah, it's not just about the physical space, though. It's also about creating an environment that fosters well-being and belonging, you know?
I see what you mean.
It's more than just meeting basic needs.
Right.
You know, that reminds me of another module.
Oh, yeah.
It's called End-of-Life Care.
Okay. Wow, that's a topic a lot of people find difficult to talk about.
I know.
But it's such a vital part of caregiving.
It really is.
I imagine that module must be really sensitive and full of insights.
It goes beyond just the medical aspects of end-of-life care.
I can imagine.
It explores the emotional and ethical side of supporting people and their families during such a vulnerable time.
Yeah.
Things like managing pain and controlling symptoms are important,
Uh,
but it also delves into things like open communication,
Uh-huh.
respecting people's wishes, and just providing compassionate support for those who are grieving.
It's about honoring someone's life and helping them through that final chapter with dignity and peace.
It is.
This diploma certainly doesn't shy away from the difficult conversation.
Yeah, it does.
You know, as we're going through these modules, I'm noticing a recurring theme:
What's that?
communication. There are several modules dedicated to different aspects of it. Like,
Yeah.
there's communication and its relevance and importance of communication in care,
Yeah.
even one called sharing information and responding to a disclosure.
Oh, right.
I'm curious, why is communication given so much emphasis in this field?
Well, think about it. Effective communication is absolutely essential in health and social care.
Okay.
You're working with people who might be in physical or emotional distress,
Yeah?
people who have trouble expressing themselves or come from different backgrounds with
Right.
different ways of communicating.
Sure.
Building trust and rapport through clear, compassionate, and culturally sensitive communication is paramount.
Yeah, it's not just about giving information.
Nope.
It's about really listening and understanding what someone's trying to tell you, whether they say it out loud
Right.
or through their body language.
Sometimes it's about navigating those really tough conversations with sensitivity and empathy. It's absolutely.
There's actually a module that touches on that directly.
Which one?
It's called Complexities of Consent.
I wonder what that covers.
It probably looks at the legal and ethical side of informed consent,
Oh, okay.
making sure individuals fully understand their rights
Right.
and have the power to make choices about their own care.
I can see how that would be crucial, especially when working with vulnerable people
Yeah.
or people who have difficulty understanding or expressing their wishes.
For sure.
Going through these modules.
Yeah.
It's really hitting me that there's so much more to health and social care than I initially thought.
It's deeper than it looks.
It's not just about providing physical care. It's
Yeah.
about understanding the whole person, their physical, emotional, and social needs.
Exactly. And you hit the nail on the head.
Yeah.
This diploma really drives that point home.
Okay.
It's about acknowledging that each individual is unique
Mm-hmm.
with their own story, their own values, and their own aspirations.
It's about empowering them to live a fulfilling life no matter what their situation may be.
And it's about building a society that supports all of its members, regardless of their age, ability, or background.
Couldn't have said it better myself.
We've covered quite a few modules so far,
We have.
but I know there are even more to explore.
Oh, yeah.
What other key areas does this Level 3 diploma cover?
Well, there are a bunch that focus on practical, hands-on skills that anyone working in a caregiving role would need.
Like what?
So, for instance, there's one called CSTF, Infection Prevention and Control,
Okay.
which covers how to maintain a clean and safe environment for everyone.
Yeah, right. That makes sense.
Especially in healthcare settings where the risk of infection is higher.
Yeah, for sure.
And then there's CSTF, Resuscitation Basic Life Support,
Oh, wow.
which teaches people how to respond effectively in emergency situations.
That's so important.
Knowing CPR and first aid can literally save lives.
Those are skills everyone should have, whether they work in healthcare or not.
Yeah.
You never know when you might need them. So what other practical skills are covered?
There's a module on medication management and administration,
Okay.
which teaches how to safely and accurately give medication, a crucial responsibility in many caregiving roles.
I bet that module also covers the legal and ethical considerations around handling medication,
You're right.
making sure caregivers are acting responsibly and in the best interests of the people they're caring for.
Absolutely. And there's also a module specifically on understanding legal professional standards of practice and ethical aspects of healthcare.
Okay.
This provides a foundation for understanding the legal and ethical guidelines that shape caregiving practices.
So it's not just about the practical know-how.
Nope.
It's about understanding the bigger picture of how those skills are applied.
You got it.
This diploma is really comprehensive.
It is.
It combines compassion with knowledge and makes sure care is delivered safely, effectively, and ethically.
That's the goal.
It's really impressive. Wow, it sounds like this diploma really sets you up for success in a caregiving role.
It does.
We've covered so much.
Yeah.
The individual focus, the importance of communication, all the ethical aspects, even the hands-on practical skills.
It's a lot.
But I'm wondering about the bigger picture.
Okay.
Does this diploma give any insight into the overall health and social care system?
It actually does.
Really?
There are a couple of modules that look at the system as a whole.
Like what?
For example, there's Safeguarding Adults,
Okay.
which delves into the policies and procedures in place to protect vulnerable adults from abuse and neglect.
Right.
It really highlights the role caregivers play in spotting and reporting any concerns.
That's such a crucial responsibility.
It is.
It's about speaking up for those who can't speak up for themselves.
Exactly.
And are there any other modules that look at the broader system?
Yeah, there's one called The Role of Public Health in Health and Social Care.
Okay.
This one explores the connection between individual well-being and the health of the community.
Interesting.
It probably covers things like promoting good health, preventing diseases, and understanding the social factors that affect someone's overall health.
So it's about seeing how caring for individuals fits into the bigger picture
Yes.
and how we can work towards a healthier society for everyone.
Absolutely.
This deep dive has been incredible.
It has.
I feel like I've gained a whole new understanding of what it means to work in health and social care.
Me too.
It's clear that this diploma is designed to create not just skilled caregivers,
Yeah.
but also compassionate and ethical professionals who really want to make a difference in people's lives.
That's the heart of it.
So for someone listening who might be thinking about a career in this field,
Yeah.
what would you say is the most important thing they should take away from exploring these modules?
I think the key takeaway is that health and social care is more than just a job.
I agree.
It's a calling.
Yeah.
It demands a special combination of knowledge, skills, and above all, a deep sense of empathy and compassion.
It does.
This diploma gives people the tools they need to face the challenges.
Yeah.
And enjoy the rewards of this incredibly fulfilling profession.
Well said.
Thank you.
It's been such an inspiring journey, and I hope our listeners feel the same.
I hope so too.
Whether you're considering a career change or just want to learn more about caregiving,
Right.
I think we can all agree that a little knowledge can go a long way in creating a more compassionate and supportive world.
For sure.
Thanks for joining us on this deep dive, and until next time, keep exploring.